Good morning, everyone. Thank you so much for being here for the ShakeOut for Long-Term Care Facilities webinar. We're going to give folks a few minutes to hop in, grab a drink of water. So we'll probably start at 11:02. If you have not already registered for ShakeOut and you are ready, feel free to take a moment to scan the QR code on the screen and get registered. Thanks so much for being here. Hi there, folks. For those of you joining now, we're just giving people a couple more minutes to join, and we will plan to start at 11:02. If you haven't registered already, again, there's a QR code on the screen that you can use to get registered for the Great Shakeout. Thanks. Alrighty, well, thank you everyone for joining us today for the ShakeOut for Long-Term Care Facilities webinar. We really appreciate you taking the time to be here today, and we're excited to get started. We will have this QR code up later if you have not yet registered for ShakeOut, so do not worry if you have not yet. So thank you for being here today. My name is Riley McNabb. I'm the Earthquake Program Outreach Coordinator with Washington Emergency Management Division, and I am happy to be leading this presentation with my partners at EMD and then also at DSHS, if you are able to introduce yourselves.
Sure. Hi, my name is Brian Turbush. I'm the Earthquake and Volcano Program Manager, also at Emergency Management Division. We'll provide some technical details on some items here and in the chat. So very happy to have you here today.
Good morning, I'm Serena Segura. I'm the Emergency Preparedness Coordinator in the Residential Care Services Division of Department of Social and Health Services. Thank you for having me.
Good morning. My name is Holly Stark. I'm the Outreach Program Manager here at Washington Emergency Management. I'll be monitoring the question and answer function. So if you have questions in there, we'll try to keep that organized and get to them in a good, timely manner.
Awesome. Thanks so much, all of you. All right, great. So moving on, some housekeeping for today. This meeting is being recorded, so you are aware, and this recording will be available and provided to you at a later time. So just a heads up. And so you will also be able to access the slides. We will send those out later, as well as some additional resources. So any links and items that you want to be able to look at in more time, you will have those provided. And then, as Holly mentioned and Brian mentioned, there's a Q&A function that we will be monitoring throughout the presentation, and then there will be time for questions at the end. So just some general housekeeping. And as a reminder before we start, ShakeOut is an optional drill. This is an opportunity to inform and empower folks with information and education and opportunity to practice, but this isn't a mandate or a requirement. So just a reminder, just a really great opportunity and optional drill. So our agenda for today, the first part will be focused on talking about what the Great Shakeout is in general, as well as providing some background information for why it is important that we have this drill, particularly in Washington. And then we will talk about how to stay safe regarding earthquakes and tsunami hazards in Washington before we move into what holding an earthquake drill looks like for a long-term care facility in part 2. And then we will close out the webinar with part 3, where we will talk about emergency preparedness planning, considerations for long-term care, as well as highlighting some resources, and then again, some time for questions. So put questions in the Q&A chat as we go, and we will track those throughout and leave some time for them at the end. So starting out, what is the Great Washington Shakeout? This is the world's largest earthquake and tsunami drill. Millions of folks take place in this every year, and it takes place on the 3rd Thursday of October each year. So this year, it is on October 16th at 10:16 a.m. And so this is an opportunity for everyone to take time, to set aside time to think about what would I do if an earthquake and or tsunami happened right now. So this is an opportunity to practice your drill, drop, or lock, cover and hold on. We'll talk about that more later. But then also to think about what would you do after, right after the earthquake? What after the shaking stops are your next steps? And what can you do right now to be better prepared for that? Again, here's a QR code for you to scan and register, and this will also again be provided in the slides later on. So why is the shakeout an important drill in Washington? Well, Washington has the second highest earthquake risk in the United States and one of the highest tsunami risks in the United States. We have a lot of folks exposed to these hazards, and we have numerous earthquake and tsunami sources. The earthquake sources that we're highlighting here are the Cascadia subduction zone. This is the big one, the most famous earthquake source that we have. These are the magnitude 8, 9.0 plus earthquakes. These don't happen very often. Most recently, this took place in 1700. And these are significant earthquakes. They have broad-reaching impact, as you can see on the screen. It extends up above Vancouver Island and not pictured here, but goes all the way down to Northern California. We also have deep slab earthquakes. These originate in the subducting Juan de Fuca plate that's going under the North American plate. So these take place deeper beneath the surface, and they take place more often, every 30 to 50 years or so. And our most recent one of these earthquakes was the Nisqually earthquake, which took place in 2001. And then we also have surface crustal faults as well that we are exposed to. And these faults are all across Washington state, eastern and western, and these pose consequently risk to all folks in Washington. This isn't just on the West Coast or just on the East Coast of Washington, or not coast, but east side. So we have numerous earthquake sources, and we have a lot of folks exposed to them. There we go. So as I mentioned, we're going to talk a little bit more about these different earthquake sources. So the deep earthquakes within the subducting slab are like what took place in 2001 in Nisqually. So these occur, again, every 30 to 50 years, and these are about 6, 7.0 plus. And although these are smaller, quote unquote, relatively smaller magnitude than say the Cascadia subduction zones, these are still significantly damaging. Within 30 to 40 seconds, Nisqually was about 40 seconds or so, there was over 400 injuries and there was billions of dollars in damages. So these relatively smaller earthquakes can still be significantly damaging. And we have an 84% chance of one of these taking place within the next 50 years. So these don't pose the tsunami threat, but they may cause other secondary hazards like landslides. Then we have our crustal fault earthquakes that I mentioned. These surface faults are all across Washington state. One highlighted in the top right is one that goes right through Bainbridge Island. And so these are more shallow earthquakes. And with that, being close to the surface, they cause very high intensity shaking. So these can be very damaging. And these are about 6.5 to 7.0 magnitude earthquakes. The recurrence interval for these is less solid than the deep slab and the Cascadia subduction zone, but we know that these have happened and they will continue to happen. And these can cause more localized tsunamis when they occur across bodies of water, such as the Seattle Fault. And then lastly, we have the Cascadia subduction zone, which I mentioned. This is a very long subduction zone going from Northern California past Vancouver Island. And this, again, doesn't take place very often, but when it does, it causes significant widespread impact. It will have 8 to 9.0 magnitude, and as opposed to 30 or 40 seconds of shaking, this will take 3 to 6 minutes. And with the Cascadia subduction zone, we know that this will create a major tsunami, which could hit Washington's outer coast in as little as 10 to 15 minutes, and the inner coast in 90 to 120. And we know that while these don't happen very often, that they have happened, and again, will happen in the future. So we're looking at a 15 to 25% chance of this occurring within the next 50 years. So we have a lot of different earthquake sources, and we have a lot of folks exposed to these earthquake sources. So we don't know when these will happen, but we know what we should expect when they do. They will occur suddenly, we don't know when, and when they do, there will be a fair amount of chaos. There will be potentially a very loud noise. Things will begin to shake. It will likely impact electricity, so lights and alarms might be going off. This might impact your emergency systems like fire alarms and sprinklers. And there will probably be broken glass, such as from windows or falling objects. And so these things are good to anticipate, as well as there will be people who are confused and probably very scared. So there might be screaming. There will just be a lot of chaos and confusion in these initial moments. So anticipating this will help you to be better prepared for when it happens, which is why ShakeOut is so important. So you not only are prepared for what to expect, but you know what to do when it happens. And so this will impact within buildings and also outside of buildings, such as trees and telephone poles may be swaying and might even be knocked over. So those can create secondary hazards that you should be aware of. And this is a video of what you can expect outside or within buildings. You can see this building on the top right. I'll play it again in just a moment. But this all happens very suddenly, as you can see. In the start of the clip, the folks in the bottom left are walking, and within 15 seconds, the building has collapsed. The building in the top right is an example of an unreinforced masonry building in New Zealand. So these are old masonry buildings that are very susceptible to partial or total collapse. And as you can see, with enough intense shaking, they can collapse very quickly. So it's important to anticipate what you are supposed to do after an earthquake and where you spend a lot of time. So I'll play that one more time so you can see how quickly that this can happen. So again, keep your eye on the top right corner and see just how quickly this damage can take place. So again, earthquakes, we can't predict when they will happen, but how they behave is pretty predictable. We know how buildings will likely perform. We know that how we should behave. And so this is just good information to be aware of now, so you're better prepared for when they happen. And with that, I'm going to pass it over to Brian, who's going to talk about some more of the secondary hazards after an earthquake.
Thank you, Riley. So yeah, that's an important thing to think about. We just saw that video of an earthquake appearing, and it looks like it's only happening in that little area, but earthquakes are a very regional hazard. They're affecting down the street, but also miles away, tens of miles away, especially these very big ones. So one thing we like to think about here is these secondary hazards, some things that might happen after the shaking itself. So one of these might be landslides that can occur, especially when the ground is wet, as tends to happen here in the winter, or during our season we're coming up on now, where we get these atmospheric rivers. So when the ground is wetter, more likely to have landslides. But for reference, there was an earthquake in 2017 in New Zealand. There were 20,000 landslides as a result of this earthquake. That was about a 7.2, 7.3 earthquake. They have pretty similar climate to us, so this is something we will have to watch out for here. Some in residential areas, but most up in the mountains and things like that. So something to think about. Ground liquefaction is another hazard that can happen when the ground shakes. This only happens in specific areas where the ground is very wet and there's loose sediment, and it only happens during shaking. This isn't like that concern for quicksand. You're going to have to avoid stepping in after the earthquake. This is during shaking itself. But also think about, as you're thinking about your facility and how you're going to plan for things to do afterwards, there might be transportation and infrastructure damage. So if you're trying to get down the road, think about how difficult it could be to get there if the bridges are damaged by the shaking, or infrastructure could be damaged to water, to wastewater, to electricity. So these are all things you have to plan for when you're thinking about an earthquake. In addition, you might have fire. There could be hazardous materials. There could be gas coming out. So these are all things we have to think about. It's not just the shaking itself. And thinking about the shaking itself, there's also aftershocks after an earthquake. So these can all happen again. I mean, we've seen over the last few weeks after the July 29th earthquake in Kamchatka, that was an 8.8. They're having magnitude 7.5, magnitude 7.8 aftershocks to that quake. So you can still have earthquakes or aftershocks that are very large for a long time after the earthquake, potentially years or decades later. So it's not fun, but it's something we really need to think about when we're planning. How will we prepare for these? And then the biggest secondary hazard we want to think about here in Washington is one that Riley mentioned earlier. Next slide, please. Tsunami hazard. So tsunamis are something we know our coast is at risk from. This is one of the most well-documented examples of a tsunami we've seen in the recent years, the 2011 Great Tohoku earthquake and tsunami in Japan. So you can see some images here. The really important takeaway we want you to understand here, the tsunami is more than a big wave. It is the entire ocean moving. It's more like a fast-moving tide that's a lot higher than normal. And it carries everything with it, from the boats that are on there to all the debris it picks up on the way. And then it goes back out. So this is something that really the only way to stay safe from a tsunami is to evacuate the danger area. Again, we have 3,000 plus miles of shoreline that are at risk from tsunamis. Next, please. So this one recent example, you can see that this entire coastline here is just scoured by the tsunami, by the waves coming in and out for 48 hours. This is something we can expect on our outer coast in Washington as a result of a Cascadia subduction zone earthquake. Really large waves that come in and out within several minutes. The inner coast would have more like 3 minutes. You'll see a simulation soon, or I'm sorry, 3 hours, much closer to that. That's a lot more time to evacuate, but on the outer coast, we're thinking like our outer ocean, Pacific County, these areas, it's Grays Harbor County, Mason County, Clallam, much less time to evacuate available. Next, please. So you can see some of the damage here, and these are tough numbers. We understand a little bit of a content warning there, but it's because we want you to understand the risk that we're getting people to prepare for. A lot of deaths, all from the tsunami, a lot of injuries, a lot of people missing, buildings damaged, and this is mostly from the tsunami itself. The earthquake was massive, but Japan has done a lot of building for earthquakes. So just think about these kind of numbers are what we want to think about. Now, next slide, please. What you're going to see here is a simulation of our Cascadia subduction zone earthquake. So when the earthquake starts, if it's a magnitude 9, you'll see a counter here in the lower left-hand corner, counting the time since the earthquake. That's in hours, minutes, seconds. So half an hour, it is already hitting the outer coast. Now that red line indicates waves that are 10 feet or higher. So anywhere from 10 to 60 to 80 feet, possibly 100. But then also to consider this 10 feet in the blue, that's 10 feet or lower drawdown. A tsunami is a series of waves, and then you also get these low areas, which is when the water comes back out or when it just drops, which you can think of as doing some damage to the boats and docks and piers in the water beforehand. So this is all impact here. You can see it's hitting the outer coast within 15 to 30 minutes, maybe these areas like Grays Harbor within up to an hour. But then coming all the way into the Hood Canal and the Puget Sound, reaching Olympia within about 3 hours. So this will impact all of Washington's coast. This is something we need to be prepared for. So next, please. Recently, Washington, that can play again in the background so you can watch it a little bit, but recently Washington has done a new run of the scenario to try to understand when this tsunami happens, exactly what we're looking at in terms of damage. And what we're seeing is 50,000 to 65,000 casualties on the coast. And you can look up this data, this run. A really important part of this, though, this sounds really bleak, but this is people not immediately evacuating, people waiting to evacuate for like 10 to 20 minutes to get together their information, their supplies. A really key point of this is the faster people evacuate, the more people get to safety. So this is why we emphasize drills so much, because that will lower these numbers significantly. Mitigation of your buildings will as well, making sure that we build these tsunami vertical evacuation structures like you can see in the Acosta School, the Shoalwater Bay Tower. These things are really important to lowering these numbers, and we can do that, but these drills are going to be a really important part in your facility. Okay, so that's a little bleak, but we're going to talk about how to stay safe next. So I'm going to pass it back to Riley.
All right, thank you, Brian. So yes, we understand that there are significant risks, and we know what that can look like if we don't get prepared. So it's important to think about, what does preparedness look like? What do we do? So with ShakeOut, the gold standard action is to drop, cover, and hold on, or lock, cover, and hold on, as I'll talk about shortly. This is the gold standard because most injuries are caused by folks being hit by objects that are falling or flying, or by being knocked to the ground during shaking. So when you drop, you're dropping your center of gravity, and you're making it so it is less distance between you and the ground. So if you get knocked over, you're already on the ground effectively. Or if you are in a wheelchair or using a walker, you're already in place, and so you are lower to the ground. And covering, we want you to cover your head and neck. These are some of the most important parts of your body. And so this will protect you if items are falling or flying at you, and to protect those important parts, as well as holding on. So you want to protect yourself, and you also don't want any cover that you find to be moving away from you, because as I mentioned, objects will be moving immediately, things will be falling. So you want to make sure that you stay connected to your cover. And so this is one of the best ways to prevent the cause of most injuries that are experienced during an earthquake. So don't try to run out of your building. We want you to drop, cover, and hold on first, and then assess your situation after. So this is just a visual of what we're talking about, of what it can look like. Drop, cover, hold on under a table. That is most standardly pictured, but you also should consider where else you might be during an earthquake. You know, most folks spend at least a quarter to a third of their day in bed, and so it's important to be prepared for if an earthquake happens then. Similarly, our recommendation is to not run, but to stay in your bed, hold on, and to protect, again, your head and your neck with your pillow. As well, you could be driving, you may be out walking in the streets, and so it's important to be mindful of those moments. And so that's why ShakeOut is a great opportunity to think about, where do you spend most of your time, and what would you do if an earthquake took place in there? Again, with the mobility devices, we similarly recommend getting lower, and locking your device. So if you're in a wheelchair or use a walker, lock, and then similarly cover and hold on to keep yourself from moving and to keep yourself connected to your device. If you use a cane, similar to, as I talked about before, drop, cover, hold on, seek cover if you can, and then keep your cane with you so that when the shaking has stopped and you need to move or leave the situation, then you're able to do so. And there's more information available on this slide, which again will be distributed to you after the webinar. So after the shaking, when should you evacuate a building? It is not always necessary to evacuate, but sometimes it is necessary. And there are some of the key situations here in which case we would want you to, such as if there is a present fire, if you can smell smoke, if you can see a fire, that is the case that you would want to evacuate. Similarly, if you smell natural gas, that would be an indication that a line may have broken, and that is also a fire hazard and just hazardous for yourself in general. Similarly, there are fire threats, such as if electrical wiring systems are damaged during an earthquake, they may be sparking, and so that's something to be mindful of. As well, there could be structural damage to the building, such as if there is large cracking in a large X shape in the main supporting walls. This could be indicating that the building is at risk of collapse. And so if you see the sign of significant structural damage, we would suggest that you evacuate as well. And then, as Brian just talked about, the most notable secondary hazard is the tsunami. So if you are in a tsunami zone and you experience shaking that was very strong and it was for a long time, then you need to evacuate. And for immediate local tsunamis, such as from a Seattle fault scenario, the shaking may be your only warning that you need to evacuate from the tsunami. For a more distant tsunami event, such as those that took place in Russia, where we have more time, there may be tsunami sirens to indicate that. And so it's important to key into what those local alerts are. But the shaking is your first sign and maybe your only sign that you need to evacuate from a tsunami. So keep your eye out for these hazards so you know when to evacuate. And so when you are evacuating for a tsunami, we want to make sure that folks know where their go bags are before time. So if you need to evacuate for an indefinite period of time, maybe you're not able to return, we want to make sure that you have the essential supplies that you need. So having go bags ready, easily accessible, and then before you move into your evacuation route. And generally that is to move upward and inland. And some tsunami routes are already well established with signage. So looking into your area, where do you spend time? What are those evacuation routes? And then waiting for the go ahead to go back to your facility if that is possible. So, and within all of this, in the bottom panel on the left, you see the X with the car. That is because when you're evacuating on your routes, we recommend folks evacuate by foot as often as possible. Roads may be damaged, infrastructure may be damaged, as Brian mentioned, but also some people are not able to evacuate on foot at all. And so reserving the roads for folks who have no other option is our goal. So we want folks to evacuate by foot as possible to keep the roads clear for people who need them and or for emergency responders, et cetera. With that, I'm going to pass it over to Serena, who will talk about this viewer up here.
This is one of the tools that we use at Department of Social and Health Services to identify what hazards are impacting our long-term care facilities. So this layer is showing our tsunami hazard. This is a historical layer that shows those impacts. So as you can see, we do have some assisted living facilities right along the coastline that are in that tsunami area, as well as nursing homes and adult family homes. So these are areas that when there is threat of a tsunami, that they should be doing some extra planning for how they are going to use that evacuation, and knowing that our long-term care facilities do need extra time, and they do need roadways to be clear for their residents who may not be able to walk those routes if they're wheelchair or on a cane. This is another planning consideration that should be part of your plan. It is our plan as we look at these facilities to plan for impacts to all of our long-term care facilities that would be impacted. I'll turn it over to Brian next. Thank you.
Thank you. So I do have some good news. For anybody who's unfamiliar, we know that we can't predict earthquakes, but we do have a tool here in Washington that is freely available to all of you on your phones already, called ShakeAlert. This is an earthquake early warning system by the USGS that works in Washington, Oregon, and California that can give you seconds of warning before that shaking arrives. Doesn't sound like much, but those seconds can give you vital time to drop cover and hold on appropriately for your situation, just to think about how you're going to protect yourself in that time. So also think about how a lot of people spend those first few seconds of an earthquake, especially here in the Pacific Northwest, where we haven't felt very many, wondering if it's an earthquake. Your phone can give you this confirmation. So how this works, P waves from an earthquake travel very quickly but don't cause much damage. They're about twice as fast as the damaging S waves or shear waves. So these dense networks of seismometers all over Washington and Oregon and California detect that P wave. They estimate the magnitude of the earthquake and they estimate which areas are going to shake. And then they send out an alert to those areas. So this can include everybody's phones in those areas. We'll have links here, and I will make sure to share the mil.wa.gov/alerts page so that you know where you can find, how to find this on your phone so you can practice with it, because again, that practice is important. If you hear that sound and don't know what to do, it doesn't really help you very much. But yeah, so this is a tool that's available to you. A little bit more about it. Next slide, please. So 3 ways to get it on your phone. Wireless emergency alerts. If you've ever gotten an Amber Alert, this system is likely turned on for you already. You can get alerts about this. Now, again, this is only going to let you know about an earthquake that is going to shake your area. You're not going to hear about an earthquake in California that's not going to affect you, even if it's really big. If you get this alert, it means it is time to protect yourself. It's going to be light or greater shaking above if you get one of these. So it doesn't tell you exactly how big it's going to be, but if it was smaller than you thought, you got practice, which we really can't take for granted here. So again, wireless emergency alerts, you should all have those turned on. It's a really important way to also get those tsunami alerts. If you have an Android phone, search for earthquake alerts because this is built-in software that's already there. And then if you want to download an app, you can download an app called MyShake. It says it's from Earthquake Warning California. It works in Washington and Oregon as well. And these are all part of earthquake early warning. They will let you know before earthquake shaking arrives in your area. Potentially seconds. So really important tool, really important to know how to use it. Next slide, please. And then finally, this system is not only on your phone, but there are other ways that it's used as well. Might be worth thinking about these in some of your facilities as well, ways that it can be used. So for example, like the Bay Area Rapid Transit in California, it slows down their trains when they get an alert so that the train is moving at a slower speed when the earthquake strikes. To minimize number of injury of passengers. We have a lot of schools in Washington that also have this on their PA systems, maybe in case the students don't have their phones on them at all time. That might be a school rule or something. So just think about ways that you could use this system to potentially mitigate danger in your area. For example, there's also like bringing elevators to the closest floor and opening the doors. That's one that could be implemented here. We have some water and wastewater systems that are like shutting off their pumps so we don't lose water afterwards, and we can use it for drinking and firefighting. So a lot of applications. Again, we'll send out this slide deck, but if you have questions about this or think about some ways you might be able to use it, please feel free to reach out, because installing the system, installing this tool in more places will really help keep people safer in an earthquake. Pass it back to Ryan.
Awesome. Yeah, thank you, Brian. So with all of this and considering what alerts do you have, what plans are we looking at, the question is, how prepared is your facility for an earthquake? And so we have some considerations that we're going to go into further detail on here. So thinking about preparedness more broadly, we're talking about alerting. So how will folks be notified? Think about the staff in your facility, think about the residents, think about the family and loved ones of residents. How will they know what is going on? Do they know how they will be notified, etc.? And then we talked a bit about evacuation routes, but are they even aware that there is a tsunami risk? Do they know how and when they should evacuate? Have they practiced it? These are big considerations for facilities that are within the tsunami inundation zone. And then more broadly, emergency plans in general. Does your facility have an emergency plan? Has it been updated recently? How will folks communicate? Is there communication plans already in place, like contact trees, etc.? Are there reunification plans? These are just some questions that we want to think about for most places, but in particular long-term care facilities for preparedness. And then, as we mentioned when evacuating, and even if you don't have to evacuate, having go bags. Are staff and residents aware of preparedness and the need for go bags, such as essential medication, personal important documentation? And is there a place to store these supplies? Is there a good way for folks to access these, and do they know where they are? So these are some things that we want to think about, is making sure that you have all of these, and then you're also rotating these and restocking these over time. Items will expire, things will go out of date, phone numbers change. These are things that we need to think about. So with ShakeOut and beyond, holding a drill is a really great way to look at your emergency preparedness and your planning and to test how it works and what needs fixing. So we're going to talk about some different types of drills that you can look at, and more generally why they're important. So we've talked about generally educating folks and raising awareness on their risks and the hazards that they're exposed to. But one of the main things that we want to highlight is building muscle memory. So drop, lock, cover, and hold on. We want this to be second nature. So when an earthquake happens, folks aren't confused about what to do. They know exactly what to do, which is one of the most important protective actions that we can take. And then building up the muscle memory of they know exactly where their go bags are, and they know exactly how to evacuate if they need to. So building muscle memory through drills is a really important benefit of these, doing them and then doing them often. And then with your plan, when you do drills, you are able to identify what didn't work. Maybe you are testing your evacuation route and you realize that it's not clearly marked and folks get confused. Or maybe you're testing your communication plan and someone doesn't answer because they no longer work there or their phone number changed, etc. So doing drills allows you to identify those issues and then find a way to fix them before the hazard takes place. And then it's an opportunity more generally to look around your facility and to consider how prepared is it for a hazard. I'll talk a little bit about that more shortly. But generally, it's just an opportunity to dedicate time to thinking about your hazards, how prepared you are, and to identify ways that you can become more prepared and to better take advantage of any warning that you receive if you have alert systems in place, and just to make sure that folks have this system down and routine and can feel more confident and less scared about their risks. So some of the questions that you might be asking when considering what drill and what type of drill that you hold is, what are you wanting to test? Do you have folks that you just want to generally test their basic safety, make sure that they know what to do? Do you have communication plans that you want to test and messaging systems that you want to utilize? Your evacuation routes and procedures, your emergency plan in general. These are questions that you can test through drills and identify where things are working and where things have room for improvement. And then when looking at the different drills, you want to consider the resources that you have available and who all is able to participate. Are you able to include the staff, also the residents? Are you able to include the loved ones of residents? Because all of these people will be impacted. So consider who you're able to involve in the drill. So in general, the larger the size of the drill, the more resources that it will take, the more time it will take to plan, and more complex. But this will provide you more comprehensive information on your preparedness and planning and education levels. But the more simple drills, while they require less resources and time, they still gather really essential baseline information. And so all of these provide really important knowledge to your facility and to the folks in the facility on what to expect and how they can improve their preparedness. So all of these are great. And so these are just some factors to consider when selecting your drill. So the most basic earthquake drill that we recommend is the drop, cover, hold on, and tsunami evacuation. So again, most of us will be doing this on ShakeOut on October 16th, but you can do this at any time that's most convenient for your facility. And so we recommend that you do the drill, you walk or talk through your evacuation procedures, and you share information about earthquake safety. Just take it as an opportunity to let folks know about their earthquake and or tsunami risk, and make sure that they're aware and practicing these critical first pieces: drop, cover, hold on, and evacuating. And you can use internal messaging to let folks know ahead of time, as well as using a PA system to announce when the drill is happening. And you can always do more, which is what we will talk about for doing a slightly more mid-range drill. So doing that essential drop, cover, hold on exercise, walking and talking through evacuation routes, and then doing one more thing. So as we talked about earlier, you can look at the hazards within your facility as room for improvement. So for example, if you have tall bookcases in your facility, are they strapped to the wall? Will they topple over during an earthquake, et cetera? You could also test reunification plans. You can involve loved ones to make sure that the communications are in order to get them reunified with the residents at your facility. These are some additional actions that we recommend you do on top of the basic drill to just gather more information and to be more prepared. And so this looking inside your facility is what we would call a hazard hunt. These are non-structural retrofits, in other words. So are those tall items secured? Are heavy items secured? We often joke that if you have a bowling ball collection, you don't want to put that over your bed. We want to have heavy things lower, closer to the ground, less room to fall. We want to have things secured to the wall so they're not tipping over, and just become more aware of what might become a hazard during an earthquake. This can help keep folks safe, such as from items toppling over, but can also prevent the loss of important equipment and items that you have in your facility, such as in this video on the right. You can see that a monitor is strapped to the desk, because that would also be very dangerous, but it would also be very expensive if it toppled over and broke. So a hazard hunt is one of those additional items that we recommend folks consider doing in their more mid-scale drills. With that, I'm going to pass it over to Serena to talk about tabletop exercises.
So tabletop exercises is a discussion-based type of exercise. And what you want to do is bring people together. So your key partners, and they'll bring their plans. You have a scenario that's pretty basic so that you can talk through the different issues with your plans in play. So for this one, the scenario is it's 10 p.m. on a Saturday. Most residents are asleep, and there's limited overnight staff on site. A magnitude 6.8 earthquake occurs, and shaking lasts for 48 seconds. The building sustains structural damage, and roads to and from are blocked with debris. Cell phone service is overwhelmed and unreliable. So using that as a scenario base, you would talk through how you would do your drop, cover, and hold, how you would evacuate your residents and your staff, who you would contact, and how the partners would try to assist and provide resources for your facility. So you'd walk through that scenario, you'd identify strengths and areas that need more work, what is missing from the plan, what needs to change, what has changed in your environment since the plan was written, what is working well. Are there additional partners that should be included that might have been missed for the tabletop or in your planning? How long will it take for residents to return to their usual standards of care? That's a great consideration to have here. Are staff prepared to support residents, and for how long? How will staff rest if they are caring for residents when there is a disaster. Considering impacts of additional factors would be power outages, fires, inclement weather, such as heat or cold. So we need to think about what other things would impact if we had to evacuate due to an earthquake that caused structural damage to our facility. Next slide, please. The biggest type of exercise you can hold is a full-scale exercise. So this is really what we call boots on the ground. This simulates what would be happening if there was an earthquake or tsunami that just occurred, and walk through the emergency plan and procedures. Typically, this is done with multiple partners, and it is moving from the start to the finish and focusing on certain aspects like simulation, communication, blackouts, addressing continuity of operations, bringing in other partners for supply chain issues, for transportation, emergency management, and determining whether plans would work after an earthquake. And then to conduct an after-action report meeting to address any of the gaps and issues that were found during this type of exercise. Next slide, please. So here are some long-term care facility considerations. There is a QR code on this slide that you can follow, and that will take you to the Department of Social and Health Services resources page for long-term care facilities. So some things to think about before the next earthquake is our secondary hazards. Is the facility in an area with secondary earthquake hazards for tsunami, for landslides, liquefaction of our road system? These are all things to consider when we would have to evacuate. Take a look at your emergency plans. Does the facility have emergency plans in place that are sufficient? Are they tested regularly? Evacuations, there are several things to consider. Do you know your routes? How are all your residents going to be able to use that route? How are staff going to assist residents? And what should residents know when to evacuate, and how will they know to return? So these are good things to think about for your planning efforts. We should also think about our alternate facilities and where we would go if there was an earthquake that caused structural damage to your facility. In a localized area, going down the street probably isn't going to be a viable option. So thinking about other facilities outside of the area that could be possibilities if the structure of the building was no longer viable. Also, backup systems. Are there electronic systems in place that are needed after there is a disaster? So do you have battery backups or generators for those residents who need equipment that takes power? And then also Holly mentioned the hazard hunt, and again going through that to make sure that there are no additional hazards within your facility that could cause harm to residents and staff would be a great opportunity. So you are the experts at your facility. Every step you take now will help your staff, your residents, and your facility be safer in the next earthquake. Next slide, please. So for the facility staff, having them have evacuation education and awareness for the plan and for evacuation routes and what that means for your facility is very important. Emergency plans and procedures should be in place. They should be reviewed and tested at least annually. Practicing drills such as ShakeOut every year is a great way to build muscle memory so that staff and residents understand what to do when there is shaking. There are alerting procedures and contact procedures that should also be part of your plan. Emergency kits are important to make sure that staff and residents have the supplies that they need when there is a disaster, including earthquakes and tsunamis. And they should be updated regularly as well. We should also be thinking about what staff coverage looks like after disasters. Staff will obviously need to rest, but how are new staff being notified? How is that process going to work during a disaster? Another consideration is transportation procedures. Do you have vehicles that can transport all of your residents, or do you have agreements in place so that other organizations can come and help with transportation needs as required? And also mutual aid. So what other mutual aid do you have that's available to you? And then there's some resources at the end of this slide that you can go to find more support for your planning efforts. Next slide, please. And this is considerations for our residents and families. So thinking about our emergency communication, what does emergency communication mean between residents and their family members? How will they be able to contact them, or how do we communicate to family the status of the residents of the facility? Education and awareness for residents about the hazards and how to stay safe during an earthquake. We practice through drills and having emergency kits to make sure that we are 2 or more weeks prepared when there are shortages for all of our supplies. We'll also need to think about medical needs. So residents have prescriptions. How will those be accounted for? How will residents receive medication if they are moved from the facility for evacuation? What about their devices? Do they need electricity for their devices? How long can they be away from them? What other facilities can accommodate their medical device needs? Some facilities have direct care, so we need to acknowledge that that care support needs to continue. So what does that care look like during a disaster, and how does it return to normal? And then finally, thinking about the mental health of residents and staff is important. We learned during COVID-19 response that when we did isolation, that mental health was greatly impacted negatively. So what does this mean during a disaster, and how can we support everyone's mental health to the best of our abilities during a disaster response? And then for families and loved ones, making sure that we know how to establish communications between the facility or the resident and the family members, how reunification will work if there's an evacuation, how will they be reunited with their facility or with their family after the event, and how do we make sure that they have their important documentation, their medical records, their personal records, and how is that stored? Next slide, please. Next, I'll pass it over to Brian for additional resources.
Thank you. So yes, just telling you about all the problems is not the only thing we're going to do. We're also going to connect you with some resources to help you answer those problems. And this should help answer some of the questions I've seen in the chat as well. So one we highly recommend looking at is the 7 Steps to Earthquake Safety. This comes from earthquakecountry.org. Really good site that comes out of California. They have a lot of experience with earthquakes down there, and this is all lessons that they've learned from there. 7 steps divided into prepare for earthquakes, the things you can do before, how to survive and recover. So it's got a whole section on how to drop cover and hold on in a variety of situations, including that /accessibility page we looked at before that gives it a whole bunch of other alternate ones for people that may have mobility challenges or any sort of accessibility issues. And then improve safety. That step 6 is really good for immediately after the earthquake, things you need to think about. And then finally, after the threat of the earthquake and tsunami have passed, step 7 about reconnecting and restoring. These are good resources to look at now before the earthquake, just to think about the things you're going to need and maybe see if there's some things that'll really specifically help your facility here. Next, please. One thing to consider as well is structural retrofits. Riley mentioned there are unreinforced masonry buildings in Washington. We're working on going through and retrofitting them or identifying them at all for now, hoping to help provide some financial support for folks to retrofit them in the future, because it can cost a lot to fix these bricks. But yeah, securing your building in any way you can. Like, for example, if you're in a wood frame building, securing it to the foundation is really important. So this is something that is expensive, but it is definitely worth it if you want to make sure that you are in a place that can survive after the earthquake, that you can know you can be safe in. Because think about that. After an earthquake, you might have power outages, you might have infrastructure damage, but having a safe place to basically camp indoors, that shelter is going to be really important for a while. So structural retrofits can be really helpful, but those non-structural retrofits are going to be extremely helpful as well. Just making sure things won't fall over. Next slide, please. So we got a number of links here, and again, we will be sharing these slides as a PDF, but some ones I want to focus on here as well. As Serena shared earlier, the DSHS page for emergency planning guides, those are going to be really helpful with ideas about how to help your facility plan for these emergencies. Great Washington ShakeOut has a lot of resources, including a section specifically on healthcare facilities. They've been doing these for a long time in California as well. So they update that every year with new materials on things to consider during a drill, how to take care of patients. So there might be some good things to look through if you're interested in that. There's also a ShakeOut drill manual for businesses if you consider yours more of a business as well. It's got some other things to think about that are important for just record keeping. That are going to be really important afterwards. You can always email us with your questions as well if you don't fit them in the chat here today or in the Q&A section, or we don't get to them with timing. But public.education@mil.wa.gov, we will direct you to somebody who can help answer your question. Really important ones here as well for tsunami, because you got to know if you're in that zone and what your evacuation routes might be. A bunch here, you can see some models. You can see the online portal with DNR Geology Portal, which I'll show you in a second. Yes, just a lot of documents here to help understand where there is tsunami hazard and how to evacuate there. In addition to, of course, one of your first lines of defense, one of the first people you should reach out to in your community is your local, either your city, if they have it, or your county emergency management office, because they are there to help make sure that people in your area know what the hazards are and what you can do about them, most importantly. So local emergency management, reach out to them. That's going to be really important. Let's go to the next slide. A few more just general preparedness. You can always find our mil.wa.gov/preparedness page. We might just direct you there if you reach out to public.education, but we'll try to answer your question specifically. We have a whole bunch of videos available. They're quick draw, they're really easy to watch. Very short videos that cover a lot of concepts, and a whole bunch of other materials on our EMD Prepare YouTube channel, which is where this video will be uploaded. So you'll already be there when you get the subscription. Check it out. Got some activities too if people want to learn about it. A Prepare in a Year guide trying to break down preparedness into 12 easy steps. So it's not so overwhelming. It can seem like a lot to do all these steps, but doing it a little bit at a time, always a better idea. And then again, a lot more tsunami resources, mil.wa.gov/tsunami. We will send these out so you can take a look at them again. And see all those websites. But then again, these earthquake homeowners guide, 7 steps. There's a whole website about earthquake insurance if you're considering that, from our Office of the Insurance Commissioner, and then some other earthquake insurance projects, because that's a whole nother question. It's not required to have earthquake insurance, but it is up to you. So it's best to be informed about that. Those 2 websites will really help you decide whether you want to purchase earthquake insurance for yourself or your facility. Next slide, please. Alert resources. The main one I'm going to send you to right here is mil.wa.gov/alerts, where we've actually compiled all of these other ones. There's information about Shake Alert, earthquake early warning, information about how to make sure you get these tsunami alerts other than the shaking itself, and information even about the volcano notification service. These are all free services, and then that can also connect you to your county's local alerts. And most of those direct right to the county's webpage. So if you want to talk to them about your local resources, your local evacuation routes, that's going to be a really good place to be directed. So mil.wa.gov/alerts, really good resource for making sure that you're informed in an emergency. Next slide, please. And then let's just go over this geologic information portal from our Washington Department of Natural Resources. The Geological Survey has this together. If you go there, the default is just going to show you what kind of rocks are all over the state. But you can turn that layer off, the surface geology, and look at things like the ground response. Is this ground more likely to liquefy? Am I more likely to have trouble there? What we find really useful here is you can actually type your address, think about your facility, but also your home, because it's going to be important to be able to get back to that facility afterwards, and just see if there's additional hazards here you need to think about, whether it's the earthquakes, liquefaction, whether you're in a tsunami area. If you look up the tsunami, this will actually show all the evacuation maps in that area. So you can download those directly from this site. This is a really good one to go to for that. I know we had a question about that earlier, so really good to learn about, but I highly recommend this site as a planning tool to help you out. Recommend looking at it on a desktop. It is hard to use on your mobile phone, but this is what it's for. So just a recommendation here. And let's go to the next slide. All right, so again, thank you for your time. Really appreciate that you're considering these. Hope you sign up for the Shakeout and are willing to participate in this. We have a few minutes left, so let's see if there's any good questions that we want to address manually here for everyone to hear. You can look in the Q&A section, but yeah. So Liza asked a question here about a website that shows where to go in case, and I hope that was answered there with the geology portal and your local emergency management. That's what we recommend for this. I will type that here too, so you have those links. And I haven't looked to see if more questions are showing up yet. So Riley, do you want to take that over?
Brian, there is one in the chat that's asking, and I think you kind of addressed it, but just maybe so that everybody can see. It says, in case of power outage, what to do if clients are using equipment that need electricity? I'm guessing that's like medical equipment, breathing apparatus and stuff, if there's no generator in place.
Good question. Serena, would you like to start that one?
Sure. So this is a great time to start planning for if your facility does not have backup generators for residents who need electricity for their medical equipment. So a few things that you can do. You can reach out to your power company. A lot of the power companies are doing public safety power shutoffs for wildfire season, so they may have some resources, but also to start thinking about having an extra battery pack. Like Jack Reed makes a battery backup that's for short-term use. If that is something that can be added to your emergency kits, that would provide electricity for a few hours to a few days, depending on the type of product that you purchase. You could reach out to your local emergency management office to find out what resources are available through the county that you're in. And then if this was during an earthquake that impacted your facility and power was out, you could reach out to your county to let them know that you needed additional resources. If the county can't fulfill those, they would elevate that request to the state to see what additional resources are available. Another thing is to think about your mutual aid agreements and if you could move that resident to another facility that does have power. Anything to add, Brian, or?
I think the thing we can, thank you for that. I think the thing we can stress the most here is now, before the ground is shaking, is the best time to prepare for these. And as was mentioned before, if you're prepared for an earthquake and tsunami in your area, next time that there's a storm, next time there is a minor power outage, you are going to be so prepared for it. We understand it is tough, but we hope that the resources that have been provided here and the contacts will really help you to get some of the things you need to start preparing for these, because it's really going to help to get people ready for this. We are here to help at the state if needed at your county. But yeah, it's going to be big when something this big happens. So all the preparation that you can do now will really help everybody to prepare for these. And we appreciate that you're here learning about it. Just saw a question here. A nursing home with 92 beds located at the top of the inundation zone. Have the staff required by law? How do you evacuate to a safer elevation? Excellent question. That is a great question to start thinking about now, I think is the right question here. So most of our tsunami warnings that we get, as were mentioned before, are going to give you 3 to 4 hours. They're going to be distant, kind of like our Kamchatka earthquake or one that happens in Alaska. Most of these are going to happen from around the Pacific. But when that earthquake shaking stops, if it was long and strong, it is time to evacuate just for safety. So how would you do that? In your facility, what are the procedures you have in place to evacuate people? What do you need to do? And another part here, if you're at the top of the inundation zone, that might mean that the waves won't reach you. These are like maximum considered earthquake. However, it is better to be safe because you saw those pictures of the area that's been, so the most you can do in that small amount of time is the better. Anything you can do is better than doing nothing. So think about how you can speed up that evacuation now and if there are procedures you can do. Again, I recommend checking those resources for healthcare facilities to see what they've done about patient moving. That'll be a really good resource just to see how others have done this. Don't forget you're not alone in this as well. There are others who have considered these problems before, not just in Washington, not just in the US, but all over the world who have addressed these problems. So if you need some help finding those contacts, please reach out and we would be happy to help. That's why we have these contacts here. Yeah. Anything to add, Serena?
Nothing to add, Brian. Thank you.
All right. Well, I'm seeing that it is now 12 o'clock, and so I want to respect folks' time. I'm seeing that there are a couple other questions in the chat, but we should be able to respond to those afterwards. But just want to first and foremost, thank you all so much for attending today. These are really important considerations to be thinking about now, so thank you for taking this opportunity to do that. And thank you to Brian, Serena, and Holly with co-presenting with me and assisting and facilitating the Q&A. And I am available to stay after a few minutes if folks want to register for ShakeOut and are confused of how to do that. The QR code is up here. But for the rest of you, you can expect a follow-up email with the slides as well as links to resources. And we will do our best to get to the rest of the Q&A in the chat. So thank you all.
Thank you, everyone.